If you are over 60 and you have those twisted, ropey veins running down your legs, and your doctor has told you they are just cosmetic, just something you have to live with, I need you to stop right now, because what the research actually shows contradicts everything most people have been told. 33 million Americans are living with varicose veins right now. Studies published in the American Journal of Preventive Medicine show this condition is far more dangerous in adults over 60 than in any other age group. One large-scale study found that the risk of varicose veins nearly doubles after the age of 65. And here's the part that really matters. Left untreated, varicose veins can lead to blood clots and open wounds on your skins. And in some cases, a life-threatening condition that travels to your lungs. Today, I'm going to show you 8 warning signs that your varicose veins are getting dangerous, and exactly what you and your doctor can do about it. This video is for educational purposes only. Please speak with your doctor before making any changes to your health or medication routine. Let me start with a patient who changed the way I think about this condition entirely. She was a 64-year-old retired school librarian. She had visible veins on her legs for years. Nothing alarming, she thought, just something that ran in her family. But one evening, she was sitting in a recliner after dinner, and she felt a deep, burning ache in her left calf, different from anything she had felt before. She pressed on the vein. It felt hard, almost like a rope under her skin. The area was red, warm to the touch. She assumed it was a pulled muscle. She put a heating pad on it, and went to sleep. What she actually had was a blood clot forming inside a varicose vein, a condition called superficial thrombophlebitis. Within days, the clot had extended deeper. By the time she came in, she was diagnosed with deep vein thrombosis, a condition that, if not caught, can send a clot directly to the lungs. She was not an isolated case. She is the rule. Today, I am going to walk you through 8 specific warning signs. Your varicose veins need medical attention, backed by research from the Cleveland Clinic, Johns Hopkins Bloomberg School of Public Health, the National Institutes of Health, and peer-reviewed journals published in 2024 and 2025. If this kind of research-backed information helps you, make sure you subscribe so you never miss content like this. And before we go any further, drop a comment right now with just one word. Veins, tell me you are watching. I read every single one. Now, let me give you those 8 warning signs. The first one is pain or heaviness. It gets worse as the day goes on. Most people with varicose veins feel some aching, but here's what I want you to understand. When the discomfort becomes constant, a dull, throbbing feeling, when your legs feel like they're filled with lead by late afternoon, that is not just aging. That is your veins failing to push blood back up toward your heart. Think of it like a garden hose with a kink in it. The water backs up, the pressure builds, and over time, the hose walls weaken and stretch. That is exactly what happens inside a vein when the valves stop working. According to the Society for Vascular Surgery, ongoing leg pain and heaviness are among the earliest clinical signs that chronic venous insufficiency, a progressive disease, is developing. Pain that builds through the day is a signal, not a nuisance. Ask your doctor specifically, can we do a duplex ultrasound to check whether my vein valves are still working properly? And here is where it gets important. When pain keeps you off your feet, you move less. When you move less, circulation drops further. And when circulation drops, the valves weaken even more. It is like being caught in quicksand. The more still you stay, the deeper you sink. But you're not powerless here. Knowing this is exactly how you break that cycle. The second warning sign is swelling. that does not go down overnight. Pay close attention here. This is the part most people miss. Everyone's feet and ankles can swell a little by evening. That is normal. But when the swelling is still there in the morning, when your shoes feel tight before noon, that is a red flag. When vein pressure builds for long enough, fluid from your blood begins to leak through the vein walls into the surrounding tissue. Your legs and ankles swell. In some cases, and I've seen this myself, the skin itself begins to weep, clear fluid. According to clinical research, this type of swelling, called edema, directly precedes skin breakdown and ulcer formation. Swelling that does not go down with a night of sleep. It needs to be evaluated. Ask your doctor, is my leg swelling coming from my veins, and should we check for fluid leakage into the tissue? Well, let me ask you something. Has your doctor ever ordered a vascular ultrasound during a routine checkup? Most people over 60 never get one. And that is exactly the problem. The signs of vein disease build quietly for years. By the time they become visible, the damage is often already done. The third warning sign is skin changes around your ankle or lower leg. What I am about to share surprises most of my patients. The skin on your legs can actually tell you what is happening deep inside your veins. When blood pools in the lower leg for months or even years, the red blood cells begin to break down under the skin. And when that happens, they release pigment that stains the tissue permanently. Your skin may turn reddish brown or look darker, thicker, almost leathery and tight. I know this is difficult to hear, but skin discoloration around the ankles is one of the most reliable signs that varicose veins have progressed into chronic venous insufficiency, a condition affecting over 30 million Americans. And once that skin changes, it becomes fragile. A small scratch, a bump, even dry skin can open into a wound that will not heal easily. So if the skin around your lower leg looks different than it used to, darker, thicker, shiny, or itchy, that is not random. That is your body sending a message from the inside. Ask your doctor, is this a sign of venous stasis? And what stage of vein disease am I in? Now listen carefully. There are natural approaches that can help manage symptoms, but never add anything new without speaking to your doctor first, because what works for one person can interact with medications in ways you may not expect. The fourth warning sign is itching, burning, or a rash near the veins. This one is almost always missed. In fact, more than 70% of people over 70 with varicose veins experience persistent itching near the affected area. This condition has a name, venous stasis dermatitis. And here's what is really happening. Blood that pools in your veins begins to irritate the skin from the inside. That burning feeling, the redness, the dry, cracked patches that look like eczema, they're not just skin problems. People are told, use a moisturizer. You have dry skin, it's eczema, and all the while, the real issue keeps getting worse because the problem is not the skin, it is the circulation. Ask your doctor, could this be venous stasis dermatitis, and should I see a vascular specialist instead of treating it like a skin issue? And I want you to think about this. How many people have been treated for eczema for years when the real cause was sitting inside the vein the whole time? Years of the wrong treatment while the disease kept progressing. Please do not let that be your story. The fifth warning sign is a vein that feels hard, like a cord under the skin. I want you to really hear this next part. Soft, bulging vein is one thing, but when that vein suddenly becomes hard, when it feels tight, tender, warm to the touch, that is not normal. That is a sign, a blood clot may be forming inside the vein. This condition is called superficial
thrombophlebitis. And while it often stays near the surface, it can extend deeper. And this is where it becomes dangerous. Research shows people with varicose vein have a significantly higher risk of developing deep vein thrombosis. In some studies, up to 5 times higher. Let that sink in. 5 times higher. A vein that is hard, hot, or painful needs medical attention the same day, not tomorrow, not next week, today. Ask your doctor, can you rule out superficial thrombophlebitis or deep vein thrombosis with an ultrasound right now? The 6th warning sign is an open sore or wound near your ankle that does not heal. This is more serious than most people realize. These wounds are called venous ulcers. They are the most common serious complication of varicose veins. They form slowly, but once they appear, they are extremely difficult to heal. The skin around them has already been weakened by poor circulation. They are prone to infection and often return again and again. Research shows between 60 and 80% of all leg ulcers are directly linked to vein disease. Think of it like this. It is a warning light on your dashboard. You can ignore it, but the problem underneath is still getting worse. Any wound near your ankle that was not caused by an injury and has not healed within 2 weeks must be evaluated immediately. Ask your doctor, is this a venous ulcer? And what is the fastest way to treat the underlying vein problem? The 7th warning sign is bleeding from a vein with little or no injury. Now, this surprises most people because they assume veins only bleed when something hits them, but over time, as vein walls weaken, a varicose vein close to the surface can rupture on its own. No fall, no cut, no warning, just blood running down your leg, and this can be dangerous because pressure inside the vein can cause significant blood loss before it stops. If this ever happens, sit down immediately, raise your leg above the level of your heart, apply firm, steady pressure, and call for help. This is a medical emergency. Do not ignore it. Ask your doctor, are any of my veins at risk of rupturing, and should they be treated before that happens? The 8th warning sign is leg cramps at night that keep waking you up. Pay close attention here because this one is almost always misunderstood. Most people think it is dehydration, low potassium, or just aging. But often it is something else. It is poor circulation when blood pools in your leg veins instead of flowing back to your heart and your muscles. Don't get enough oxygen. And when oxygen drops, muscles cramp. Think of it like an engine not getting enough fuel. The system is fine, but the supply is blocked. So if you are waking up night after night, with tight, painful cramps, and you have visible veins, and do not ignore it. Ask your doctor, could my leg cramps be related to poor venous circulation? And should I get it checked? Now, let me give you something practical. A simple self-check you can do right now. No equipment needed. First, sit down and look at both of your legs in good light. Notice any areas that look darker, shiny, or different. Second, press your finger into your lower leg for 5 seconds. When you lift it, does a dent remain? That is called pitting edema. It means fluid is collecting in your tissue. Third, run your fingers along any visible vein. Does it feel hard, warm, tender? A normal result, even skin tone, no swelling, soft veins. An abnormal result, discoloration, persistent swelling, or a vein that feels different. If you notice any of these, write them down and take them to your doctor. Now, before I give you your action plan, there's something important. Most doctors do not have time to explain. There are natural compounds supported by research that may help support vein health, not cures, but support. The first is grapeseed extract. Research shows it can strengthen vein walls and reduce swelling. The second is rutin, found in foods like apples and citrus. It supports
capillary strength. The third is garlic. It supports blood flow and helps reduce internal pressure. And the fourth, with some of the strongest evidence, is horse chestnut extract. Studies have shown it can reduce swelling, similar to compression therapy. Listen carefully. Never start anything new without speaking to your doctor first, because what helps one person can interfere with another. Now, here is your action plan. This week, call your doctor and ask for a duplex ultrasound. Start walking daily. Even 20 minutes helps. Elevate your legs above heart level for at least 30 minutes. Ask about proper medical grade compression, not generic ones, but fitted ones. And if you have any of the warning signs we talked about today, do not wait. Act now, because early action changes everything. You now know something. Most people your age and it have never been told. And that knowledge is your protection. Now type one word, veins, in the comments. And if someone you love and has been told these veins are just cosmetic, share this with them. It could genuinely matter. I publish research-based health content every single week, explained in a way you can actually so subscribe so you don't miss what comes next, because in the next video I'm going to show you the hidden connection between varicose veins and your heart, and one daily habit that quietly makes it worse without most people realizing it. You're going to want to see that. Stay informed, stay aware, and take care of your health.